And good afternoon. Welcome to the webinar, and hopefully someone's hearing me right now. Oh, Don, Larry, Charles, Mark. Okay, hi. Thank you very much, guys. You're seeing it, and we are good. Excellent. Hope everyone's having a good day today. I always like this time of year in Georgia. The summer's gone. It's not too hot. The winter's not yet here. It's not too cold. It's a beautiful time to go for a walk. And walking is one of the best exercises that you can do. And it's one of my personal favorites. I personally enjoy hiking in the woods, but no matter where you're doing it, going for a walk is a good exercise. Every study that's been done talks about the benefits of walking. And that's why we're focusing on promoting something that people know they should be doing, people like to do, and giving them a way to do it just a little bit differently and giving you a way to help them do it a little bit differently and make them more aware of what they're doing. We're going to be going over a number of different things today. There's a new study that came out that strongly supports the strong posture concepts. And we're going to be giving you a tool for promoting Spinal Health Month at the end of this webinar, whether you're a CPAP or not. And so if you have any questions along the way, please type them in and I'll be happy to answer as many as I can get to at the end. So our theme is Spinal Health Month. It's about motion. If you look at the poster, it begins with, we take moving and walking for granted. But we're going to be tying that together with a new study that came out in Spine literally last month. Motor control exercises reduce pain and disability in chronic and recurrent low back pain. And this is a great way to tie the literature to what we're doing with strong posture, which is promoting moving well. Let's begin with the poster. This is a handout. You'll be able to download it. And it talks about how loss of spinal motion, whether from a sudden injury or from a gradual loss over time, can rob us of the simple pleasure of taking a stroll. And especially as studies show the benefits of regular walking, it's smart to take a look at how we walk and be mindful of moving well as we walk. So this is the message that we are putting out there. People take moving and walking for granted. Start to pay attention. We want people to become more mindful of how they're walking, how they're moving, and opening the question, how well are you moving? Instead of just being, yes, I am, creating an awareness of quality. And creating awareness in anything requires looking at it in more detail, what we call granularity, and seeing and observing and teaching people how to observe some of the things that we observe when we look at them from a gait analysis point of view. Because if you begin by asking the question how somebody is moving, that then opens up the stage to begin training body awareness in that person, as well as training the ability to have motion control exercises as being something important. Especially if you spend a lot of time sitting, creating mindfulness of your posture, of your body as you're moving, helps to keep your spine strong as well as strengthening, making your posture more tall, so you look good and move well in everything you do. Positioning posture as key to making the spine function better and making you be able to move better is one of the ideas behind the strong posture protocols. You have to keep moving well as you age to keep moving well as you age. Put out the idea about motion control exercise both in a clinical framework as well as to the general public. And if you're working with it, you know how well they work. If not, it's something that you should be adding to what you're doing to position yourself as the posture expert and to help your people keep on moving well. Great new study just came out in Spine that I want to share with you. Motor control exercise reduced pain and disability in both chronic and recurrent low back pain patients. This was a meta-study. They looked at 16 other studies. And the kind of exercise, motor control, fine control exercise, is what strong posture exercise is. And all exercises that focus on motion begin with awareness. The study talked about these exercises having been devised to correct motion deficiencies and to retrain movement patterns for better control of spinal motion, and that these things are being used worldwide in the treatment of low back pain. And this goes along with the concepts first put out by Punjabi in 2006 the mechanism that they support of low back pain is that there's a spinal instability resulting from injury to structures in the proprioception of the spine. These embedded mechanoreceptors, once they're injured, create a cycle of pain and instability that spiral down. In other words, poor posture creates adaptive motion creates poor posture. And accessing this cycle with someone's awareness of how do you move, asking the question opens up the difference between how they think they're moving and how they're truly moving. And the next question becomes, how do you want to be moving when you're growing older? Especially in a sedentary population, but in every population, athletes, young, olds, mindfulness as you move helps to strengthen your posture. Everyone that has had a mother tell them, stand up straight, knows that when your attention is focused on posture for a moment, you can shift it. The trick is keeping it that way. And the challenge is you can't without thinking about it. Therefore, the goal is to retrain your body so it stands tall on autopilot. That's just the way you do it. In order for that to happen, you need to change how you're using the muscles, which means you need to change how you're moving everything, including your spine, in everything you do. So the message is mindfulness as you're moving helps keep your posture tall and your spine strong, making it an aesthetic thing as well. You look good and you move better in everything you do, walking, running, living life. And the ideas that we talk about in the 5 posture principles goes along with the concepts from this study. Also quoting Punjabi, he talked about spinal stability depends upon the passive articular system, the active muscular system, and a neural control system. We popularized these ideas with the first of the 5 posture principles, motion, and the body's motion systems are contracting muscles, connecting ligaments, fascia, and joints, and controlling nerves, both central and peripheral nervous system. Same exact concepts, more accessible labeling. And the work that we do towards popularizing posture and motion is continuing with the new PostureZone app for iPhone. It also works on iPad, Android we're working on. And it works with the PostureZone model of giving people the ability to assess their posture on a different model. How your head is bouncing over your feet, how your torso and your pelvis are bouncing over your feet, and measuring the PostureZone deviation from a center line to 1/10 of a degree, from the front, from the back, and from the side. And from a clinical point of view, this model overlays with the more common high shoulder, high hip model, as well as forward head posture by looking at the body as a whole unit functionally. At the end of the day, your posture is balancing. Posture is how you're balancing your body. That's the second posture principle. And from a clinical point of view, if you're working with people to make a difference in how they're balancing, you may be using a posterior body line, you may be using a ankle, hip, shoulder, ear gravity line and connecting them with one software or another, or just visually. By using a PostureZone model of observing the center of mass of where the feet are hitting the ground, approximating that from the front and back margin, of the pelvis, of the torso, and of the head, and looking at the difference of a real-life patient that we've seen some nice changes with, and looking at the difference in how a gravity line of posture zones is shifting, making that PostureZone alignment be what we're measuring independently when we're using the PostureZone app. So, here's what it looks like on the front view, on the back view of a PostureZone app. We set the center of gravity between his feet, between the left and the right hips, left and right shoulders, and central gravity of the head. His head should be over the center of pressure of his feet, the middle of his feet. His left and right shoulders should be over the center of pressure of his feet. You'll notice that on his, there's a greater deviation to the left to the right. This dot is a little bit low on this picture. The software has been updated since these were taken. Now the dots end up pretty much right where you would like it in the middle of a deltoid. But you'll notice that there's a significant deviation between the left and right side of the torso, which mirrors the high left shoulder that we see because his body is deviating to the right there's greater angular movement of the same anatomical point on the left side. His body's falling to the right. Same thing's happening to the pelvis. There's greater angular deviation on the left side of the pelvis. The goal is not having a perfect posture. The goal is going towards symmetry. When you benchmark somebody of their head, torso, or pelvis, you'll notice his pelvis also has a symmetry. That becomes where you're beginning. Making it go towards symmetry is a reasonable direction for clinical improvement, and it goes along with the idea that posture is important to move well. Everyone knows that. Making it something that they can be mindful of and giving them a PostureZone framework of your posture is how head balances on torso, on pelvis, and feet is a way that you can connect their posture with the problem that they presented with. If you're a patient, looking at your posture can give you a lot of insight into why you're having the problems you're having. If it's mechanical, back pain, neck pain, shoulder, knee, ankle, by observing where there's the greatest deviation from the way your body's aligning. But there's more than that, which is why if you are a patient viewing this, I suggest that you do see a posture professional. CPAPs are who we recommend. They teach strong posture exercise. And from the strong posture walking exercises, we focus on walking symmetry. And if you're using this Spinal Health Month poster, one of the exercises that we suggest is making people more aware of their gait when they're walking. Ask people, does it feel the same when you step on the left or the right side? And have them take 20 steps and just focus on it. It doesn't have to be in the office, it can be when they take a walk, make it homework. Another way to cue them is, are the heels striking the same on both sides? Or are the toes striking the same way? By looking at it PostureZone, focusing even on a smaller part of the PostureZone, you can make people increase their consciousness of their gait, and by working towards symmetry, make an improvement in how they're moving and literally in how they're standing. We strongly suggest not giving people more than one thing to do at a time. People will become overwhelmed with more than one. Two maybe, but I highly, highly suggest focus on one thing at a time, make it strong, and then go to the next. Moving up from the lower extremity to the hips and torso, looking at the arms compared to the pelvis. Are the arms swinging the same way behind the pelvis? Are they swinging the same way in front of the pelvis? Are they swinging more into the body rather than outside of the body? If you look at the left hand, is it being covered by the body when you look at them from behind? And is the right hand staying free of the body? Are both hands facing the same way? Do you see the back of the hands the same way on both sides? Do you see one back and one palm from the front? Looking at it moving up, is the head jutting forward or are you standing tall? Is your head level? Instead of simply telling somebody, stand up straighter, giving them little pieces to work on one at a time and adding those into how they're moving over a period of time is, as with the strong posture exercises, the way that you can systematically strengthen posture. This goes along with another one of the concepts that was covered in the spine study. Bergmark, who basically was the first to describe the posture control system as being a union of two different control systems. One that controls fine motion, such as the segments, the muscles controlling spinal segment motion, and a global system, which is overall how you're moving and balancing when you're moving through space. And another way of looking at this, there's the motion muscles and the stabilization muscles. And you've got to have stabilization or you fall down. That fine stabilization is where posture lives. And that fine stabilization are the muscles that we are strengthening when we're strengthening posture. And the goal, obviously, is strengthening them towards symmetry. The inner core muscles that we talk about in Stand Tall, Live Longer, which are the muscles connecting torso and pelvis, have been argued to play a major role in spinal stability. These are TRA and multifidus, as well as pelvic floor and diaphragm. This is one of the quotes from the motor control article. Stabilization begins with the core, the inner core muscles that a lot of people talk about in exercising, but they're very often not engaging, are these deep, deep core muscles. And even more recent research on 2011, a nice study came out. I talked about how standing and requires TRA to engage for posture, and a lot of the posture problems that people have are TRA, which is why if you've been to one of the strong posture courses or if you're a CPAP, you see such a big difference when you incorporate a strong posture tilt. And on the other side of it, they talked about how when people have low back pain, the local musculature exhibits disturbed motor control patterns and changes physiologic properties. Literally, the muscle becomes less able to maintain the long type 2 contraction that we need for posture. Posture is not a power activity, it's an endurance activity. You're doing it all day long. And if you're not working those muscles in a way to maintain that level of stimulation, those muscles break down and they stop working. And that's the idea behind motion control exercise, or motor controlled exercise. And they basically compared in this study motor control exercise to all types of exercise in general, to spinal manipulation, to not doing anything, just seeing what happens, to a whole bunch of different kinds of PT, and also to whether to doing it with PT as well as other exercises focused on motion. And at the end of it, the conclusion from the study was that a motor control exercise is superior to general exercise in the treatment of chronic and recurrent low back pain with regard to pain and disability. And here's one that I found really interesting as a doctor of chiropractic. They found that motor control exercise is superior to spinal manual therapy with regard to disability. So in other words, in terms of the people's ability to go back to work or do life, motor control exercise had a greater effect than spinal manipulation. However, from a pain point of view, spinal manipulation was more effective at managing the pain of chronic and recurrent low back pain. And it was also better than minimal intervention in terms of pain as well as disability. And they went on to talk about the methodology, and they quoted some of the work from Punjabi and White's cyclic breakdowns that occur, which go along with the concepts that we talk about with the posture principles and with the idea of people creating a pain cycle of injury to pain to body compensates for unbalanced motion, which we also think is more accessible to the general public in terms of understanding what's going on. And promoting the solution of building a motion cycle to counteract that pain cycle of aligned strong posture, creating balanced motion. Exercise then can be effective, which forces the core muscles to engage. And the long-term takeaway is you want to use it to keep it, stay active with daily posture exercise to move, feel, and be well is the direction that we go towards, and the idea that we strongly promote in people to stay active, to keep on moving, but move with strong posture, which brings us back to this handout, this exercise for Spinal Health Month, promoting posture awareness and promoting awareness of your posture while walking, using the ideas that we talked about earlier, as well as some other cues, and then incorporating those cues into the exercise. I'm going to take a look at some of the questions we have over here. So a couple of questions that I have is about using the PostureZone app. I'm going to come back to that in a second. The strong posture walking cues, you can make people more aware of their gait by focusing on the posture zones. How has your feet, hips, hands, shoulders, head, one at a time. Then teaching them how, using a strong posture exercise, to work towards symmetry. For example, if they're walking, the idea of try doing a strong posture tilt while they're doing a leg extension. So basically adapting alignment protocol 1.1 to gait. And you'll find that it really makes a difference in how tall they're standing when you have them add a slight, underlying slight, deep and low strong posture tilt. Focusing them on their breathing. when walking. Works out really well, beginning with diaphragmatic breathing from alignment 1.3, strong posture, 5 breaths, and then taking it one step further. If you're taking them into lateral breathing, doing something with band breathing, having them do the same exact exercise while they're walking. Not the whole time, they're not going to be able to keep their focus, but for a few minutes, for 20 steps, being aware of where and how they're walking. Moving up the posture zones. In alignment 1.2, we focus on neck retractions. Have them do a slight neck retraction, underline slight, when they're walking, to try to pull their head more over the feet. Again, I would do that after I had them engage strong posture pelvic tilt, and I would probably do that even after I had them engage focused breathing, because a lot of times if you have them focus on neck position first, if they're a chest breather, and many of them are, they're going to change the neck position by lifting the shoulders up more and create more neck pain rather than less. If you can get them to drop the shoulders back down and breathe the diaphragm, then you can come in and work on neck position. And again, these are all things you want to do one at a time. If you give somebody a laundry list of do all these things, you're going to blow them out. There's no way they're going to be able to do anything. You want to give them one thing to focus on, one granule rather, to shift, and then the next time move another granule, and over time use the accumulation of focused motion on a single granule of motion to have a change in how they're moving. Another cue that you may find helpful from a walking point of view for neck retractions is making this a balloon tie to the back of your skull. Lift the occiput. Keep your head level, but lift the back of your skull. Another progression using an adaptation from the half foam roller posture squats is doing a toe press for longer stride. When you're walking, try to take a longer stride, but push further back with your toe. People tend to take shorter strides as they age. If you tell someone to take a longer stride, the reflex is to stride further with the front foot. The problem with that is that's engaging the psoas more, which is pulling them more into a flex forward posture. So you want to cue them to press forward with the back foot, press them down with the toe. Once you've done that, then talk about having the heel reaching forward, not just stepping forward, but the heel to force them to push back a little bit with that cue. These are all different cues to use to get people to be more aware using the Posture Practice Spinal Health Month 2013 flyer. If you'd like to download it, here's the link. You will be getting an email after this webinar with a link to it in the email. You should be getting it probably about an hour after the webinar, so don't worry about getting the dashes and the underscores right. You will be getting this in a filled out portion if you're a CPAP. And in the CPAP program, on the back end of the Posture Practice site, there's a version that you can use and you can customize with your office name and information for lectures, along with the other tools in 15 Weeks to a Posture Practice and the other Posture Practice tools. But that's on the back end. More about the app. We had some questions about the app. I want to go over them really quickly. App is for everybody. You want to be using it internally. It's an iPhone app, but you can download it for the iPad as an iPhone app. You need to select, download, look for iPhone apps, otherwise you're not going to find it. But doing it internally and then teaching people to take care of others. And it looks something like this.
Here's how to take a PostureZone picture. First, move the device back and forth to bracket the person between the top and the bottom bracket. Rotate the device so that the green line is level. Click. Select the view, side view. Now move the brackets so they are around the body part in question. You can use 2 fingers to make it wider and narrower, and 1 finger to slide it. Click check, and you'll see the alignment between the head, torso, and pelvis. She looks pretty good. We're going to save this one, and we're going to put this into a patient case that I've already set up, sample, but you can also set up a new case. I'm going to take a new picture, bracket between the top and the bottom, level, click, front view or side view. Move the brackets so that they're around the body part. Torso and shoulder, you want to move separately because you can have a high shoulder or a high hip on one side and the other. We suggest using the inside bracket and getting it around the top edge of the shoulder and the top edge of the waistband. Move the bracket so that you're around it. If you want to double tap, you can zoom in for more precise bracket placement. Double tap to zoom back out. Hit check to save it. You can then hit save, and you can add a new case, or you can add it to the existing case that we've been working with. PostureZone is a great way to assess people's posture, but more importantly, to create an awareness on the part of people that their posture is how the world sees them.
So, some of the questions that you guys had about using the app, the reference points you want to use should be using the brackets to connect to bracket the head, torso, or pelvis. Additionally, there's been a couple of updates on the app since these images were taken. Each bracket now also has a crosshair, so you can put it precisely where you want it. And we on the picture that we have, you notice that the reference point was at mid tricep. The center point has been shifted so that now, if you bracket the torso, it'll be on the deltoid. If you have an older version and it's doing that, just download the update and it'll be fixed. If you don't have an iPhone, my suggestion is borrowing and getting an iPad, even an older one. If it's got a camera, you need a camera for the office, and having that be a dedicated device. We don't have it for Android yet. We hope to have it by mid-year 2014, but there's 3 other projects that are ahead of that. And if you live with tech, you know that things always take longer than you thought. If you this is the free version. The professional upgrade is very, very, very expensive. It's $10, and it's a one-time, lifetime upgrade that will give you the ability to zoom in as that one did. Also to manage people by cases, so you can break patients up, as well as to download it to your computer by syncing it, as well as emailing images out. So if you're concerned about compliance, you can do it. You can take care of pictures and do it in a very clean, compliant way. The question is, can you build posture pictures? Yes, you can. 97750, I believe, is the code. They don't pay for it a lot of times, but sometimes they do, especially if you're dealing with a PI or workers' comp case. Anyway, the idea that we talk about is building a posture practice, and using the app's goal has been to help popularize the idea of 5 posture zones and 5 posture principles, and using that as the basis for a posture practice model. We talked about that with bodyzone.com, where we had the original directory for CPAPs. If you look at the app, there's also a professional locator. If you're a CPAP, you are already on that locator. If you are not, contact Bodyzone about getting a listing. If you haven't been reading Stantola longer, you want to. If you have, and especially if you're using it in office, either customized or just off the shelf with patients, you'll find that Spinal Health Month and the Stantola longer programs fit well together. Again, to download the flyer, go to StrongPosture.com. But you'll be getting an email for it shortly. You cannot use it on a PC. It's an iOS device. It's a different operating system, and it's Apple at the moment. It will probably not be ported to PC. If you are looking for a PC-based solution, check out the PostureZone desktop application. In fact, a lot of people are using both the iPhone and the PC and the PostureZone desktop application, because the desktop application, which is PC, and no, the desktop is not Mac. I'm sorry. But that version lets you generate a report that is suitable for sending to an insurance company or an attorney, as well as giving a patient to document what the person looks like. So what some people are doing is taking a picture with the app and then syncing it to the PC in the office and kicking out a report. the idea that we talk about with the app, with Strong Posture, with Stand Tall Live Longer, is promoting posture awareness. That's what CPAPs do, and that's the goal of having and building a posture practice. Um, I hope that you found this helpful. I hope that I've answered most of your questions. I said this was going to be a 35-minute webinar, and I'm on target. We're going to try to do a lot more shorter webinars. If you like what we're doing with the posture practice, let us know. More importantly, let your friends know. Tell others, because the more people are talking about posture, the more we can build posture as a brand and help you become the local posture expert. Okay. If you're not a CPAP, check out PosturePractice.com for info. If you are a CPAP, go there, check out the back end for the customizable version, and check out PostureZone and StrongPosture.com. We have some very cool programs coming up for 2014. If you're going to be by any of our seminars later on this year, I'm going to be in Logan, Maine, Chiropractic, Pro Sport Vegas, Minneapolis at Northwestern, North Carolina in Raleigh, and Naples in Florida. I think one other, I can't think of it right now. But if you're going to be by any of our webinars this year, our seminars for the rest of the year, please let me know. We do a CPAP dinner often the night before, and if you're interested, I'd love to meet you and talk about posture and building and branding with posture. Again, this is Dr. Stephen Weiniger. If you have any questions, drop me an email, drw@PostureZone.com. Hope you enjoyed this. Give me some feedback, suggestions, and have a great afternoon. Enjoy.